Hi, my friend. How are you doing? Samuel Sane here, a happy man. I thank God for this day, and I would like to express my gratitude to God, anybody who supported me for my journey to India for poem surgery. Today, I have decided actually to speak the experience after poem surgery. I went to India, a hospital known as Kim's Hospital at Hyderabad, that is Telangana state, that is South India, where I received a world-class, very important person treatment at Kim's Hospital. I'm telling you, Indians are great, great people. And we should embrace and emulate their good habits to take care of their people and also everybody internationally. In fact, my color, my dark color, okay, so many people say chocolate color, it was treated specially in India. They saw me as a very, very special person, international patient. I do appreciate the treatment I got at Kim's Hospital. To explain a bit, I remember my day on arrival. I was taught to rest for an hour. I arrived at around noon. I rested for an hour up to 2 p.m. Indian hour. And after that, I went to the hospital for evaluation test, starting with blood tests. There were about 17 of them. I was even wondering, are they after my blood? They took about 5 test tubes of my blood. They did it. They did all the tests, blood tests. They also did heart-related tests like cardiogram before going for stomach test like endoscopy, manometry, and also barium swallow test. I really appreciate these people. They did it with a good heart. They explain everything, and they are very efficient in what they are doing. And I wish we Kenyans to embrace and emulate this kind of great people in the world. It is not a must we go to India for treatment. We can build our health facilities at this level in Kenya. We should add more with the help of the government, even private sectors. We should bring such kind of hospitals in Kenya. My friend, let me explain it. After the after the cardiogram, I remember very well, I went for endoscopy test where they confirmed truly I have achalasia cardia. After the test, they also did a manometry test. A manometry test, they check the waveform of the muscles up to the cardia sphincter through to the stomach, where the muscles are not working properly, or I can use another language, where they are not contracting properly. After manometry test, the final test that was done to confirm the flow of food or liquid into my stomach, known as barium swallow test, the timed one. I remember they were checking minute 1, minute 2, minute 3, up to minute 8 to confirm truly my issue is achalasia. After confirmation, the doctor told me, I remember it was the following day after my day of arrival, it was on a Friday. He told me, Samuel, tomorrow be ready early in the morning by 9. We will be doing the poem surgery. I was willing to do it anytime. I was ready for anything. And actually, if it were not for the barium content in my stomach, they could have done the same day. But because I had something in the stomach, you're not supposed to eat anything before the test. Before the procedure. Well and good. I thank God. Saturday morning, I went to the department, to the theater, gastro theater. Everything was prepared well with the help of paramedics, senior doctors, led by my great friend, Dr. Srinkatha Pasani. And I'm telling you, these people work in one harmony, with love, with care. They're wonderful people. I wish we Kenyans, we can reach this level. And I really pray, and I always tell you, I love to see Kenya growing to this level. They started the procedure where I was under sedation for about an hour and a half. They did the procedure for about 45 minutes to 1 hour. You can't imagine a condition I have suffered for about 15 years ended within an hour's time. You can't imagine. Here comes the story I usually say, take your kid to school. And if you're also able to go to school, make sure you go to school, learn, and do your best in class. These people are learned. I told the doctor before the sedation, kindly record the video for me of all the procedures you'll be doing during this poem surgery. He's a good doctor. They recorded the procedure. You can search it on my YouTube, Samuel Sane videos. You will see it, exactly everything they did, explained with total explanations of all the procedure. I thank God it ended well. And after recovery, I was taken to the ward, floor number 9. The hospital is big. The hospital is actually wonderful, beautiful. The wards are so clean. Their beds are, I am telling you. The bell, when you ring the bell, nurses comes without wasting time. By the way, I was given about 7 nurses. Like a VIP, a Kenyan international patient. Wow, it was good. Actually, they treated me smart. And I long for this kind of treatment in Kenya. Even if you are Kenyan, international patient, we need to grow to this level. It was wonderful. My people, I'm telling you, it was wonderful. I will never forget the treatment. I stayed in the ward for 3 days, Saturday, Sunday, and I was discharged on Monday, midday. And before my discharge, I went for a special test known as a gastrographin test. What is gastrographin test? Gastrographin test, they inject a clear liquid to your mouth while you are lying from the backside. And there is a special machine. From my video, you can see it. From the video, you'll see it's like a rotating machine, an X-ray machine. They confirm The liquid is flowing properly to the stomach without going to other sides or having a leakage. To make sure, even if I go home, I'll have no complication. You can Google and see what is gastrographin test. And I'm telling you, these people are totally advanced. I know you watch this video. Make sure and emphasize to your children, to your kids, to be serious in school. We need such people in Kenya. We need such people in Africa. We need such people. We, developing nations. Those people are totally aggressive and serious with what they are doing. After that, I was told, Samuel, the test is successful. You can now go stay in a hotel, waiting for the next review, so that we can confirm everything is okay before you go back to Kenya. My people, let me tell you, here is a story to tell. The thing, I asked my guy, the international relation manager, international, Mr. Manohar Reddy. The question was this: how much is my bill? You can't imagine what they told me. They said, Samuel, first go heal. One day before you go back to Kenya, we shall do all the calculations of your bills. You can't imagine, and you know how Kenya we are being harassed. You must make sure the deposit is there before they treat you. But in India is different. These people must treat you first. Health to them comes first. Your health comes first. My people, your health in India is special. And in Kenya, we should also go to that level. Well, I went to the hotel, which is not far away from the hospital. It's about, I can say 2 to 300 meters. And it's a nice hotel. The best treatment, I'm telling you, these people are serious with what they are doing. After 7 days stay, waiting to come back home, I went to the accounts office. We did the calculations, everything. There was a slight addition of some amount because of my condition, because I had a previous Hilas myotomy. My case was so complex, but I thank God these people managed it. The good news I have to you today, even you can see my face is bright. I'm able to swallow. I'm able to eat anything. Name them. No complication. By the way, before coming back to Kenya, I told my doctor, Doctor, are you going to give me drugs, medicine? The question was this from the doctor. Samuel, do you have any pain? Do you have any fever? Any discomfort? There was none. So he told me, go back to Kenya. You are now healed. You are fully okay. And that is my joy. My people, today I can eat nyama choma. Bring it. Though my gut is not normal like yours, because you remember I had told you earlier, I had a paralyzed cardia sphincter. And what they did with this poem surgery, they had to cut the tight muscles around the cardia sphincter. We call them circular muscles. They had to cut them round, to weaken that part that was restricting food to go into the stomach. So my gut depends on gravity. But the good thing, The restriction is no longer there. So food can flow very well. So I must take my food with help of liquids. It should not be that dry. If I'm eating something dry like nyama choma, I must have some water nearby. At least after some chewing, swallowing, I need to take some water or some juices, something good to flow, to make sure there is a flow of food. And I have no problem. I'm able to eat comfortably. It was a complex case. And as I had told you earlier, this is a very rare condition. And I have decided to make sure I create an awareness to most of the people who don't know what is achalasia cardia. No one knows where it comes from, and it can get anyone. And there are those cases. I came to learn there are some cases in Kenya after an interview, one of the radio station in Oro TV. I received some calls from some people who have got this problem, and I'm about to help them to go to Kim's hospital in India, because the POEM surgery is not locally available. And I would wish to encourage our doctors in Kenya and also the government to work on this kind of treatment, for our doctors to go for this training, to learn on how to treat people with POEM surgery. It is a latest treatment for achalasia. You can Google and find all the information about POEM surgery. And I'm telling you, you'll be fine. No complications. I thought I would have acid reflux, but none. And if I have, there is a way I was advised to prevent it, or even to handle it or to manage it. So my advice to you, don't sleep. Speak out if you have this kind of a condition, and I'll make sure you get this help of POEM surgery. I was told I'm the first person in Kenya to receive this POEM surgery. It has never been done there before. And being a pioneer, my advice to my people, don't sit there and suffer. Wake up, contact me, I'll make sure you get the assistance. And you shall be able to eat once more. I'm a stronger man. I'm adding my weight, although I was taught to limit my weight to avoid obesity, because it's also another kind of condition that needs another treatment. So my people, I'm so grateful for your support. You know what you did, your prayers, your contribution, anything good you supported me with. I do appreciate, and I pray to God to bless you and also bless your generations. You did good. Your generosity is wonderful. I'm so grateful. And may God bless you. And also, I want to advise someone sitting there unwell, sick, without knowing where to go for treatment or medication. Kindly, you can contact me. It's not a must you have the achalasia. You can have another complication. There are very learned doctors I can connect you with, and they can help you. No need to suffer. No need to suffer. Any kind of complication you have, don't sit there. Wake up, reach me, and I'm very sure I'll help you for free. And you'll be healed. You'll be treated, and all the glory to return to God. I'm a happy man. You can say I'm a happy man. And again I say, may all the glory return to God for what He did to me. He gave me the right connection. Don't give up. It is not the end of it. It is not the end of you. It is not about what you think. God will bring a solution to your condition. I have faith. You'll be well. You'll be full. Again, you'll be happy and continue to be happy with your family. May God bless you. Have a good time.